right. Hello, health heads. Welcome and thank you for checking into this dose of the Healthcare Uprising. I'm your producer, Jeremy Carr, here on the couch with your host, Heather Pierce. So tell them what's on the agenda for today, Heather.
Today is our Your Vote, Your Health series, and we have Clyde Jones from Congressional District 1 in Alabama joining us today. So he is running for a second time, actually, and he is a Democrat. and
Democrat in Alabama.
Democrat in Alabama. They are coming in hot down there, literally and figuratively.
It's definitely hot down there.
Yeah. And Clyde is just a really amazing guy, ex-military, super interesting conversation that we had with him today. So he's going to be running and up for election, voting.
Election, yeah.
What do? We vote?
Running in District 1 in Alabama for
yes.
The House.
So that's November.
US House.
November. And so we have a really great conversation with him today all about healthcare and Medicaid expansion and data centers and immigration and federal.
We really went through a lot of stuff in here, didn't we?
We really did. So anyway, take a look at this. Alabama folks, pay attention, send it to your friends.
Yeah, there you go. Without further ado, here is our conversation with Clyde Jones from Alabama District 1.
Hi, and welcome to the Healthcare Uprising podcast. Today is our special bonus series, Your Vote, Your Health. And we have, we have with us here, Clyde Jones from Alabama. You're running for the first Congressional District 1 there in Alabama with a special election here coming up in about a week, right? So good timing. Thanks so much for joining us here today. We're excited to have you.
Absolutely. Thank you for having me here with you today. I'm excited about talking to you about healthcare.
Yeah, and I'm TikTok has been a very, very valuable platform for me in finding folks like you to come on this series. And so you're our first from the Southeast region. First from Alabama. So excited to have some representation there. And I can't wait to share this with my cousins, although they're not in your district, they're in Huntsville. They've lived in Alabama for a long time, and I'm going to send them this link when this episode's live and say, share it with all your friends.
Awesome. All your friends in District 1.
Yeah, all your friends in District 1. So
they still can donate.
There you go. That's true.
There you go.
This is true. So, okay. Well, so Clyde, give us kind of the backstory. People don't normally run for office, and that's not like that's not like a common thing. It takes a lot of decisions and commitment. So what brought you here? What made you decide this is what had to happen?
Okay. Let me start back, from kind of the beginning of my career in the military. Of course, I joined the military when I was 17 years old. Fresh out of high school. I actually wanted to be in law enforcement, but of course you couldn't be in law enforcement unless you were 21. So I figured, hey, I'll travel some. I'll stay in the military for 4 years, and I'll get out, and I'll come back and be a state trooper or some type of police officer. And I was turned 18 in basic training and went straight to South Korea as 18-year-old. Let's just say I aged quite a bit that 1 year I was there. 18 years old in South Korea, but so I turned 19 over there. But so I started my career, went to South Korea, went to Fort Carson, Colorado, went back to Germany, and from Germany I went over to Desert Storm, and this is kind of how I got started. Thinking about politics, right? And thinking about the things and the decision and the people in these places that make decisions and put people in places. So I'm in a foxhole. I'm about 23, maybe 24, over in Desert Storm in the middle of the desert in a foxhole with my buddy. I hear missiles, I hear things overhead. And I think about that I've never voted before, right? I'm like, wait a minute, I've been able to vote since I was 18, but because of traveling from one place to the other, never really settling down because I was in the military, it never dawned on me that I had never voted, right? So I'm over here in this foxhole, and I think about, well, I've never voted before, right? So the people who are making decisions and putting me in these places, to be in this place, I had no I had an opportunity to have a say so in it, but I didn't take that opportunity. So that kind of started me on my road
Mm.
of thinking more about the people who make decisions, right? So
It
to put us in a particular place. Yes, sir.
the fact that they let you into the military at 17 before you were even old enough to vote for the people who were in charge of the military kind of is telling in itself.
Well,
Yeah.
yeah,
Honestly,
absolutely, absolutely. Of course, my parents had to sign paperwork to
Oh,
allow
okay.
me to enlist at 17, and I did
Hmm.
turn 18 at basic, but so that kind of started me on my road. So
Okay.
of course, I'm in Desert Storm. I actually lost a couple good friends in Desert Storm. They didn't make it back with us.
Mm.
So I spent 21 years in the military, right?
Oh,
So
wow. Okay.
so I did not get out to go into law enforcement. I decided to make it a career. So I also served in Operation Iraqi Freedom
Oh, wow.
near the end of my career. We're really at the end of my career. Um, and 2004, 2005, and I was awarded a Bronze Star for that tour. But really, it was, of course, awards are individual, but it really was all of us working together to make sure that everybody came home safely. I had 120 people that were under my care and responsibility as a first sergeant, so I was more excited about. I wasn't only excited about the award, but I was excited about bringing everybody back home safely. So that's and I retired immediately following that. Um, During my military career, again, I thought about politics a couple times. I was at a board, instructor of the month board, and they asked me what did I want to do when I got out, and without even thinking about uh, my response, I just said get into politics, right? And it
Oh,
almost
okay.
surprised myself when I said it because I hadn't even really at that point I hadn't really thought about what I wanted to do after I get out. But so I get out, I go to work for DuPont after I retired 21 years in the
DuPont,
military,
like the
like
big company DuPont?
chemical company DuPont. Yeah, I went to work for
Okay.
DuPont. Um, so I went from wearing Kevlar to making Kevlar, so which was pretty unique
Wow.
experience, right? So that was my first job. I was a machine operator making Kevlar.
Oh,
I just
wow.
spoke to the AFL-CIO conference this past Monday, and I was telling them about that because I was a member of the union,
Hmm.
working for that company, and that was a difficult job. I said
I
there were
bet.
days when I was working on that machine. I was like, man, I kind of wish I was back in the desert somewhere, But it was difficult. It's difficult.
Wow.
that's pretty rough right
That's
there.
saying
Yeah.
something.
Yeah, but I made it through, and then I later went into management. So I spent 17 years with that company. Um, the company changed here in Mobile, and that's how I ended up actually in Alabama, right? So I started
Oh,
my
okay.
career with DuPont in Richmond, Virginia.
Hmm.
Um, and then I transferred to Alabama. So that's how
Gotcha.
my wife and I, and our youngest son moved here. My two oldest were already out of the house by the time we moved here. So,
Hmm.
um, and that's how we got here. So I got involved with nonprofits with different activities. I did run for office back in 2018. One thing about this current administration, they motivate me to do more. I guess Trump
Hmm.
motivates me to do so. The first term, I wound
That's
up
been a
running for
common
office.
theme. Yeah.
You're not alone.
The first term, I wound up running for office, and now I'm running for office again here in this
Yeah.
this term. But um, when I ran for office the first time, I did very well. I didn't win, but I had people on both sides of the aisle who voted for me. It was really really relatively close, um, but that led into me getting more involved in nonprofits. So I was the president of the board of directors for Alabama Arise. I don't know if you ever heard of them, but you probably should have. If you talk about healthcare, it's very good.
Hmm.
It's a good idea to have them on to talk a little bit more about Alabama healthcare because
Oh,
we have a whole
I love
department
that.
that works on Medicaid expansion, right? So
Okay. Yep.
in
Real
Alabama.
important.
So
Hmm.
yeah, so it's very important. So I saw the effects of in the overall overarching mission is to eliminate poverty in the state of Alabama. So I saw the effects of how policies are keeping people in the
Mm-hmm.
poorhouse, right? Or keeping
Yeah.
people uninsured, keeping people with no medical coverage. I saw how the state's systematic policies were doing that. So
Mm-hmm.
when the opportunity came up, I took an early retirement in 2024. I was like, you know what? I'm gonna run for office this next cycle. Um, when it comes up, my intention was to run for a state House of Representatives here in Alabama because that's who we worked with, the Alabama Rise Direct. We lobbied the state legislators, and my intention was to run for the state House of Representatives. I called a political consultant friend of mine. She was all excited. By the time I hung up the phone, within minutes, she had sent me a draft of a press release announcing my candidacy. About a week later, she calls me and said, "Hey, I just got off the phone with some people at National. We need you to run for U.S. Congress. Have you ever thought about that?" Which I hadn't really
Wow.
hadn't even considered it. Be
That's a
honest with
big step up
you.
from
Yeah.
state to federal. That's a big difference.
Yeah, it is huge. But and I told her, I said, let me talk it over with my wife and some other people, and we'll see. That day, as soon as I got off the phone, I told my wife about it without hesitation. She said, "I can see you. That's you. Go for it. You got it covered, right?" I was like, "Okay." So, well, that's a
Yep.
good vote of confidence right there. My wife
Support
said, "Yeah,
support from the wife.
yeah."
That's worth gold.
Yeah. So then over the weekend I talked to a few other people and I called her back on Monday and I said, you know what? We're in. And that's pretty much how my candidacy got kicked off, right? We started putting a team together. We have a great team. Of course, things have changed some. When I first started campaigning for Congressional District 1, the district was completely different, right?
Yeah, I was
Then
looking at your district. It's
right.
some kind of
They
wonky.
did they just redraw your map?
Yeah.
They redrew the map, right? So
Oh my
so when
gosh.
That's fun.
the decision from the Supreme Court came down for the Louisiana case, of
Uh-huh.
course, originally our governor here in Alabama said she wasn't going to do it. All these governors got a call from this current administration said you will call a special election. I mean a special session to redraw the maps.
Mm-hmm.
So Alabama followed suit, and they called a
Okay.
special session to redraw the maps, so which changed my district. So I had to requalify in District 1. And then Congressman Figures, who is a great representative, who represents District 2 now, and so he's up for reelection. He had to requalify for District 2. So what they were trying to do is draw him out, his district out, and trying to get rid of that Democratic representative. Right? We only have
Mm-hmm.
2 in Alabama, so they were trying to get rid of at least one. But what I
Right.
think they've done, and I seriously think they've done this, and most people agree with me, they have created an opportunity for not only for him to be reelected, but for me to get elected as well. So I'm excited about that, and
Let's
we are
go.
working towards that.
Yeah, I like that.
I'd like to see you get elected too. So that's why we're talking to you today. So
We got to elect. We need new people who will make rules about this gerrymandering.
yeah.
That you have to draw sensible districts. Get a nonpartisan commission to draw the maps
Right.
so that they make sense.
Yeah.
Because man, looking at these,
that's what we did.
and pick a
that's
state,
how-
like
yeah,
it's everywhere too. Like literally
It
pick a
is.
state, look at the map, and you're going to go, how the hell did they come up with all these crazy shapes for their districts?
Mhm.
It's all gerrymandering.
Yeah.
All gerrymandering.
Yeah. Louisiana is. They are really special when it comes. If you look at their maps, they are
Mhm.
really. I mean, it looks worse than Alabama for sure. But
Yeah.
but
Wow.
what they did for District 1 is this was a R22 plus 22 district.
Wow.
But when they redrew it, it went immediately down to about a plus 15. And
Okay.
I truly believe it's a whole lot less than that right now because of the efforts of our team and what we've been doing campaign wise. So
Great.
we're excited. We're excited about the possibility, right?
Yeah.
Well, I'm excited for you. Well, so this, obviously this podcast, we focus on healthcare, and so I want to ask you some questions about that kind of, what are some of the issues that you face in your state, in your district, and now that it's been redrawn, because I looked at it and you've got Mobile, right? So you got on the coast and then it kind of goes up and over like inland. So I imagine there's some diversity there in terms of economics and things of that nature. I'm making an assumption there, so you'll have to tell me. But also too, like there's like direct healthcare. I want to talk about data centers too a little bit because that's
Yeah.
like a real hot topic, and I know that you've talked a little bit about that. But
Mhm.
then there's like the indirect, right? Like so the social determinants of health and things of that nature, and things that I think that local policymakers, local all the way up to the top, right? Like you can impact that from a policy and legislation perspective. But let's start with kind of like the direct healthcare things. What are some of the issues and the challenges that you see in your district and maybe across your state? It sounds like you've got some great experience in the Medicaid space. I do too. So I love talking about Medicaid.
Yeah.
Love to see Medicaid expansion. So let's start there and maybe just we'll kind of see where the conversation goes.
Sure. So Medicaid expansion, of course, Alabama is one of those states that has not, expanded Medicaid. So
Right.
there is a huge gap, right, between the people who uh, make too much to be on Medicaid
Mm-hmm.
and don't make enough to have some type of health care, right? There's anywhere between 200 and 300,000 Alabamians on any given month that fall in that gap. So that's a
That's a
lot
lot.
of people who
Yeah.
don't have health care, right? Who don't have
Mm-hmm.
coverage, right? At any given time. So that is really one of the major issues that we see. Of course, Medicaid expansion would also help with our rural hospitals, right? We have rural hospitals. We actually had a major hospital in our capital in Montgomery that was on the verge of closing about a month or two ago, right? So
Oh wow.
not just rural hospitals. You're talking about one of the largest
Mm-hmm.
hospitals in the capital city that was on the verge of closing. So again, Medicaid
Wow.
expansion is essential uh, to the well-being and the quality of life for people. And you talk about our district a little bit. So my district it's only 4 counties now. It was 9 before they redrew them, but because I
Oh.
have the entire city of Mobile now, it's only 4. But take for instance where I live, right? I live across the Mobile Bay on Baldwin County. So this is if you we have some of the prettiest beaches you ever want to go. Gulf Shores, Orange Beach, White Sand, clear water.
Mm-hmm.
So if you want a vacation, please come down to
I've heard
Alabama.
about Gulf Shores quite a bit
Yeah.
actually from
So
my
so
family that lives in Huntsville.
so so we have people who have made their money, who have retired and come down here. We have people that are still working. We have a lot of industry, a lot of jobs um, that are available. But then we also have a lot of jobs that aren't paying a livable wage, right? So
Mm-hmm.
so those people fall in that gap um, that they can't afford, health care. They can't afford medication. I won't call any names, but I know of a situation where someone's on medication for being bipolar, and uh, they got a job at Amazon. Um, they were on Medicaid initially. They got a job at Amazon. Amazon kept their hours just below the requirement to be able to cover them as far as their medical coverage is concerned. So they
Mm.
lost their ability to be able to afford their medication. Uh, and then they had a mental health crisis, right?
Of
So,
course. Yep.
um, which again leads to many other problems. They could,
Mm-hmm.
it led to the police being called, so forth and so on
Mm-hmm.
because of certain situations. But you hear those stories all the time, and they're all over the place, right?
Oh yeah.
So again, this district now, and we have tourism, we have industry, we have government contracts with shipbuilders, we have, and then we also have farmers, right? We have up in cattlemen, uh, um, farms up in some of the rural parts of the county. So it's very, very diverse, and just like most parts of the state. We just happen to have beaches, right? So we have more tourism dollars than a lot of other districts. But as far as healthcare is concerned, the communities, um, the shortages, right? We don't the free clinics or the people that I've talked to a gentleman the other day because of his premiums tripling, right? For because of, he just dropped his health care altogether, right? So he couldn't
Oh
afford to
man.
pay that the premium that he
Mm-hmm.
had with ACA. We
Oh,
this
through the
current
exchange,
administration
yeah.
cut out a lot of the
The
supplements and
subsidiary or
subsidies,
not
subsidies that they
subsidiaries.
were given,
Subsidies, thank you.
a
Yeah.
lot of the subsidies they were given uh, got cut out. And a lot of the things that were cut because of this big ugly bill, I mean the big beautiful bill, don't even take effect until 2027, right?
Mm-hmm.
So, and I think that was done on purpose, right? It's past the midterms. Most
Past the
people are like, oh
midterms, yeah.
yeah, it's
Yep.
past the midterms. So although some people have been affected already, the brunt of it, the brunt of the cuts don't even take effect until
Yeah.
2027. That's
As bad
why
as it is, it's going to get way worse. Yeah.
it's gonna get
Mm-hmm.
way worse than that. That's why we need a change in November, right? We need a
Yeah.
change. We need to elect people who have compassion for folks. When you have leaders that have no compassion, they don't. A leader doesn't have any compassion. Doesn't care about whether you have health care or not. They don't care whether you have groceries on your table or not. They don't care about those things because as long as they have what they need and they're making
Mm-hmm.
their money, and that's another one of my pet peeves is making sure that we don't keep sending people to Washington that go to Washington just to get rich by doing insider stock trading and all those other things, right? So
Right.
we have too much of that
That's not
going
the
on.
point of it, right? The point of
Right?
it is to
That's not
serve.
the point of it.
Yeah.
So many of them they're taking money from the pharmaceutical companies. They're taking money from the healthcare insurance companies. They want to keep those things, keep those premiums high, keep people paying top dollar for medication. When you have lawmakers who are taking money from all these people, they are not up there working to make sure that we provide health care for everyone, right? And health care for all is what my goal is. Now, how do we get there? It's going to be a heavy lift to get there, right? But we can
Yeah.
fix the things that we can fix, right? We can fix those subsidies. We can fix those things that have been cut away um, from the ACA. It was never perfect, but ever since it was passed, people have been chopping at it and taking items away from it. So now they'll look at you in the face and say, "Well, the Affordable Health Care Act is not so affordable, is it?" No, because you've been taking things away from it for 10
Right.
years, right? 15 years. No, it's not as affordable as it was, right? or as it should be, right? As it should be. But we can fix those things. We can do budget reconciliation. Lawmakers can get in there and actually kind of put back in the budget those things that were cut, and that's what we need to have happen. So I know that was a lot to say to talk about with the subject that you brought out, but uh, of
No,
course,
it's
healthcare is key to all of that, right? It's key to
it is.
affordability. It's key to people having a good quality of life. Um, it's key to all of those things. So
Yeah, healthcare. I mean, healthcare shows up in a lot of different ways. And I think, like when I mentioned, social determinants of health, housing is healthcare,
yeah,
food is healthcare.
Yeah, the SNAP benefits thing is huge right now, too.
Yeah.
You got
huge.
grocery stores closing down because not enough people can buy enough food because they don't have
Right.
SNAP anymore.
Well, and who, when you don't have health insurance, right? Who absorbs that, right? Your ERs, right? And then everyone
Right.
wonders, why are my premiums going up? Well, because everyone's going to the ER because they don't have another choice. And, all the things. And, community health centers, right? Federally qualified health centers, they absorb the costs often because of which they serve, Medicaid, Medicare, but then they have sliding scale for cash pay only, They're meant there to
Right.
serve the communities. So, they absorb that. And then we've got healthcare staffing shortage. It's just like, if we would just, healthcare for all, which I am 100% behind. And I do believe we have the blueprint for it. And it's Medicaid and it's Medicare, it's CMS.
Yeah.
We have the blueprint.
Right.
We've been building it for 4 decades.
It wouldn't even be hard for us to implement.
Yeah.
At this point, it really wouldn't. And we can just look at the way every other country in the world does it.
Yeah. So it's not like it's not like we have nothing, right? Like we've been working towards this. Yeah.
Right. So, we do. So. We absolutely have, like you said, the blueprint is there. But you have to have people in office that are willing to actually put it into place, right?
That's right.
Again, they're getting paid by these other folks who don't want those things to be in place. But again, it helps everyone, because just like you said, when people don't have health coverage, the people who do have coverage, their premium is going to go up, because they're going to get that cost will be absorbed somewhere, right? So we, our premiums go up along the way.
And your wait at the ER is going to be a lot longer.
And your wait to see a specialist will be months longer. And everything takes more time, more money, more time, more money.
People don't care about things until they have to care about it, right? Like, oh, not my problem. Right. It's like NIMBYism.
It's got to walk up and punch them in the face before they notice it's there.
Right. Yeah.
Yeah.
So.
Absolutely. Yeah, absolutely. I mean, even, of course, I use the VA system, right? Okay. I'm a disabled veteran, so I use the VA system. But even with that, they're making cuts to this administration is making cuts, and then they'll turn right around and say how they're taking care of veterans, and then you're not taking care. And, they say, oh, we're processing claims much quicker than the previous administration. Yeah, when you deny everybody's claim, it's easier to process claims, quicker than
just rubber stamp the big no on it.
Right.
There's a lot of no's.
It goes quicker, right, when you do that. So I mean, if you look at the numbers, you're doing it quicker. Yeah, absolutely. Yeah. But again, getting into specialists, getting into people, seeing, specialists, that even in that system, it's taking longer, right? Even in that system, it's taking longer.
Yeah. I've heard that my friend here in Flagstaff, she's a veteran, and she had a stroke a couple of years ago. So she gets, quite a bit of care through the VA. And she has told me that just in the last year, she's lost a lot of the benefits that she had, a lot of therapies and things that helped her, that they provided, that she's lost in part of her recovery of getting her left side back. And that's unfortunate. And it really kind of pisses me off, quite honestly, because I saw how it was helping her, and then they take that away. So, yeah.
These are veterans, man. Like,
got to take care of our veterans.
All the people in this country that we should really make a point of taking care of. Those are the ones. Like, we have a hospital system just for them for that reason. Yeah. And they still can't get just proper help.
It's unfortunate.
It's unbelievable. With a $1.5 trillion a year budget, the military can't take care of its veterans. They can bomb whoever they want, but they can't take care of the people who are doing the work for them.
Yeah. Very small portion of that will definitely go towards healthcare. That's for sure. But
it's kind of always been that way. Like, you're a Desert Storm guy. I'm Gen X. Yeah. I know a lot of guys who went to Desert Storm, and they came back with the weirdest health issues, and they didn't want to address it for 20 years.
Wow.
Right.
Like, a lot of guys came back and died from things that they didn't even know what they had because it wouldn't be addressed.
Yeah, because whatever they were exposed
to. The burn in the trash pits and like the burn in the oil wells.
Yeah,
and
the burn pit and all of that. Yeah, absolutely. And this administration has they stopped funding that portion of because they had a whole department that was dealing with people that had were around burn pits and all of that. Because I have a letter from Desert Storm that they issued to my unit that, hey, this person was exposed to this and that and the other. You know what I'm saying? So those things are super important that we take care of.
When Biden was president, he was dealing with that because he had a kid in the military. Like, he actually was trying to do something about the whole burn pit situation. That's from Desert Storm, man. That's from the 90s.
Yeah.
That was like a 25-year-old problem that the president,
Yeah.
that a president was finally like, we should probably do something about this.
Yeah.
20-something years later, like, what's that even worth?
Yeah. But then this administration got rid of it right away. I mean,
of course they did.
But yeah, our oldest son is in the Army now, so and that's it's near and dear to my heart too. He's actually deployed to the Middle East right now, so
really?
So that's always in my mind about making sure that we have people in place who understand what it's like to have to send sons and daughters over in harm's way for no real reason other than I don't know what the reason supposedly is in this time, but just to have be putting people in harm's way for no particular good reason.
Yeah.
Sure. Speaking of that, this is going to be my great segue. I do this sometimes. I find these great segues in these transitions. I want to talk about data centers. Data centers potentially harmful to our health, right? I know you've spoken a little bit about this on your TikTok platform. I believe you're somewhat passionate about this. Can you talk about what's going on, maybe if not directly in your district or in your state, where there's data centers being proposed, and kind of what are your thoughts on that? What's kind of what is your what's your perspective?
That is a very hotbed subject right now. I certainly think we need to put a moratorium on building new data centers until we really understand the effects, the environmental effects, and effects on the community. I worked in the chemical industry for years, right? I worked for DuPont, so I worked in it, and there were federal regulations that they had to abide by, right? They had to abide by. They had to have a certain water source. They had to be able to treat their water, and it seems like to me the data centers need to have all of those things in place, because first of all, they don't need to be pulling water from, and I hear in other parts of the country, they're pretty much causing droughts or drying up water sources for some.
They want to put one here in up near Page, and it's
next to the Glen Canyon Dam, which is already Deadpool. It's like 3 feet from Deadpool.
It's insane. And we're like, how in the middle of the desert?
That's the Colorado River, man. Like, they want to use Colorado River water, which there's already not enough for millions of people in the Southwest.
And you're going to pull it
to put into data centers.
It's madness. Anyway,
they want to put one in Tucson too.
Yeah.
So exactly. So the same thing that you all are seeing, right? We're seeing in every state, right? So Alabama's no different. We have Tommy Tuberville, who trying to be governor. He is. I mean, I don't know who's paying him as far as to carry the load for data centers, but he's all for them, right? He wants them. He wants them all over the state, right? So pretty much, But again, we don't have federal regulations. I had made. I saw a young lady make a comment on probably that video that you're talking about, but on Instagram or whatever, and said we have all the information we need. I don't believe that at all. I don't think we don't have the information we need of how the effects on the environment, health wise. We don't have those things yet for data centers, and we need.
They're pretty new.
And don't care about getting those things, right? They don't want answers. They just want to hurry up and get those data centers built. So and what's the rush?
It's even Texas. Greg Abbott's having a problem now because they want to build all these data centers in Texas. That if you add it up, they're going to use 5 times just all the time. They're going to use 5 times the max load of Texas's power grid. 5 times the amount of power that their grid is capable of carrying.
Yeah,
is how much these data centers want. Like, how do you even do that?
Yeah,
like how are they not, like, they're city-sized data, like these huge data centers? How can you not make them make their own power? Like, put solar panels on the roof, dude.
Yeah.
Put windmills around it.
Windmills, there's all sorts of green energy.
Make your own damn power. And if you need water, you're going to have to figure that one out for yourself too, because we're not supplying it.
Yeah,
like, I honestly see it as a purposeful sucking up of resources. They're not even doing it to make money. They're doing it to suck up the resources so they can charge us more for everything.
Which is already
Everything.
Utilities are already sky high. I don't know how it is there in Alabama, but
it's sky high. It is sky high. We're under the Southern Company, which I think has Georgia, Tennessee, and Alabama, and I mean, they own the politicians, right? They own. That's what they give their money to, the ones that are making the decisions, and that's why I'm not taking money from any of these corporate PACs or any of these companies like that, because I don't want to be obligated to them to make decisions in their favor at all.
Right.
So, you know what I'm saying? So,
but I'm thinking about like utilities. We're talking about data centers, and I'm thinking about this story in Georgia that was on the news, and it's been like on social media about how the water supplies are being tainted there near anyone who lives near those.
Right. They use up the water and what's left is poison.
Yeah. Are there any data centers going up in Alabama already?
There's one, I think, being built up near Birmingham area.
Okay.
They were trying to put a solar farm here in our area to power one in Montgomery.
Really?
But the residents of that area really fought against it. So that's on hold right now. But I think they have started construction on one in Birmingham. So I was just talking to a friend of mine who's running for Supreme Court justice here in the state of Alabama the other day, and she didn't want to be too boisterous or talk about the issue too much, because when she gets on the Supreme Court, she don't want to recuse herself because of statements she's made, about, because it'll probably get to the Supreme Court when it comes to putting these data centers in places or whatever. So she, and I understand, her position there. She can talk about certain things, but some things, when you're running to be a judge, some things you just don't want to talk about too much because you don't want to have to recuse yourself when you get there. So she's kind of that. But there are some coming up. That is definitely it's going slower, I think, than the powers to be right now want it to be, because people are pushing back, right? Communities are pushing back. My friend Doug Jones, who's running for governor, he called for a moratorium. He's pushing back, right? So that's one of his platforms. Hey, we're not going to build any more data centers until we understand the effects and how it's going to affect our environment, our community, our health. So he's certainly pushing that as well. So, yeah.
I mean, it seems kind of crazy to me. Like you were mentioning, you worked at DuPont. There's regulations, right? In any big industry like that, right?
Yeah.
How there isn't, like, talk about putting the cart before the horse, right? Like, we don't need this that badly. Like, let's slow down. Everything has moved way, 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 way too fast, and
it's, what problem are they solving for? Like, I can't understand the problem that data centers are solving for.
Making things get done faster. And admittedly, like, I love ChatGPT. Not going to lie.
The internet's instant, man. Like, you can't get faster.
Yeah. But like, we're good. Like, let's just like stop, slow down, and kind of assess, right?
Yeah.
Like, I agree with you with the moratorium. I think that we need to pump the brakes here.
Right. And like I said, AI is here to stay. But why the rush on so many data centers, right? I don't get it either. I don't understand.
Yeah, like I want them to define the problem they're solving for,
right?
With all this AI buildup and data center stuff, because I don't see the problem that they're solving for. The internet's working, man. Like, you don't need to have these giant city-sized data centers to make the internet work or to build your AI. Like, it's really not a thing you need. We don't need it.
We have sufficient tools at the moment, I would say.
Yeah, and you could spread it out. Like, I have...
And human capital, right?
I have 15 terabytes of storage capacity personally.
Yeah.
Right.
Like, if I needed to, I could become our own server. I could be the server for this podcast. Like, they don't need data centers.
Yeah, it's crazy.
They could tell people, do it yourself.
Yeah.
And I would have to have a dedicated machine that was the source for this for people to watch.
You're like, this is
or listen
absolutely
to.
necessary.
The data centers are an extravagance.
It's just not.
And they're a wasteful extravagance. And I literally don't see the problem they're solving for that. And the problems that they do say that it's solving for, I'm like, there are far simpler and easier ways to solve for that.
Or we
you don't need that.
We have bigger issues, right? We have much bigger issues in this country, which some of which we talk about here on the show. And actually, I do want to kind of like move on here a little bit. To not beat the
you don't
data
want me to rave about data centers.
The data center horse.
Well, flock cameras.
Yeah, Jeremy.
Do y'all have flock cameras in your area?
I would love to talk about flock cameras.
We do. NAU actually.
I thought they took them away here in Flagstaff.
NAU has they have them on campus. That's our college here, Northern Arizona University. I'm calling them out. They have a private contract with Flock now. There's going to be flock cameras on campus.
So we did have Flock here in Flagstaff. I'm pretty sure there was like a whole thing. They took them away recently. So they're not, well, supposedly. Do you have them there? What's your take on this? Tell me. I want to talk about this.
We actually have more over here in Baldwin County than they have in Mobile, which is amazing to me. And I'm not sure what well, I mean, I don't know if we want to talk about immigration, but part of the thing here in Baldwin County is ICE is extremely active, right? I just got the report yesterday. They arrested 250 people in July. So it ranges between 250 and 300 people. And every time I see that number, that's how many families that have been, torn apart, really. And that's how I look at it, right? Because these people aren't out here. They're not criminals per se. They're not out here committing crime. They're going to work. Right. They're doing this. They're doing that. So part of why they have these flock cameras in Baldwin County is they're tracking license plates. They're looking at facial recognition. They're tracking and they look up registrations on the cars, so forth and so on. So again, we have quite a few over here in the county that I live in. So.
Gosh, I feel like that just creates such a tense environment, right? Like to tie it back to healthcare, right? Like it's just like kind of like the general.
There's really no privacy rights in this country at all anymore.
No, that's a tough one. I'm not a fan. Not a fan. It feels very invasive.
Because it's not just reading your license plate; it's pinging your phone, and it's pinging the phones of everyone in your car. Well, and it's so invasive.
Yeah,
it's unbelievable.
At what sacrifice at this point?
I get having the cameras to read the license plates. Helpful law enforcement tool. It's that I can see. But when you start pinging people's phones every time they drive by one of these cameras, and literally collecting their personal data just for driving down the road. That's not okay. That's invasive. That's an invasion of our privacy rights.
Yeah, I do feel like that too. And actually kind of tied to the immigration thing. And I do love talking about well, we like talking about anything that's, hot.
Yeah, right.
That's
against fascism, because if I say anti-fascist, then we're terrorists.
Don't say that. But the immigration situation, what it creates, and again, this is my job, is to always tie this back to healthcare, right? And we actually had a really great nonprofit called Philly Healthcares come on last fall, and what they do is they serve from a healthcare perspective the immigrant community. They had like a big Afghan community, for example, there in the Philadelphia area, as it turns out. And what happens when stuff like this is happening, these ICE raids and all these things, these people, right? These humans that live here in our communities are not accessing healthcare because they are afraid they're going to be identified. And then what happens, right? Small things lead to big things. And then that becomes a community health problem. And are you seeing anything like that in your area?
Every day. Yeah. I actually have a young lady on my campaign team that works with the immigrant community, that she's the one they call when a child's parents get picked up, by ICE, and she has to go secure the child, make sure the child's taken care of, so forth and so on. So and she tells me and gives us updates about what's going on. So we see that all the time, and people are afraid to go seek health care. They're afraid to go. I mean, you have people afraid to even go to work. I mean, and they're here to work, right? But they're afraid to even go to work, and many of them are they're doing the right things as far as documentation, going to their appointments, so forth and so on. But in many cases, they don't care about that. They pick them up, they like lock them up for a while, and then they won't even ask for the documents right away. And that makes them even more afraid to again access healthcare
and it gets them just hide in their house, like interact with our society at all. It's scary.
Oh,
and
absolutely.
we were talking about FQHCs earlier, or community health centers. They typically serve those immigrant populations, right? Guarantee you, ICE has got eyes on all of them.
Oh yeah, like
so
as soon as the name gets entered in that computer, they know they're there.
Yeah, and even if they're going through the right process, I will use an actual personal example. My husband's a painting contractor here. One of his best guy, literally best guy he's ever had, just got deported, picked up. He's not a criminal.
Because he had a DUI 23 years ago.
Yeah, this guy, all he did was hustle. Ago. And so he's sitting in some detention center down in Florence. He's been there for a couple weeks now. And they're going to, I don't know, drive him across the border at some point and drop him off. And his entire family here now are just like, forget it, we're out. And they've been here for decades. The entire family, 2 families leaving, picking up and leaving. Super productive people
because they know if they stay, then more of them are going to have to go through that same thing.
Yeah, they're like, we're not wanted here anymore.
And that's what's happening here, right? Again, last month was our county alone was 250. The previous month was 300 and some odd, people. So, and those same people, right? Those same hardworking people who have been here for many for decades,
paying taxes.
Paying taxes, right? Yeah, a valuable member of the community who attend church here, who have been paying taxes, who've been working here. I'm gonna tell this quick story, and I was at 2 months ago. I was at a 3-year-old's funeral. His mother and his aunt got picked up. They were traveling from Pensacola, Florida, to Mobile to work. They got picked up at a traffic stop near where I live, in my county. The sister had missed one appointment at the courthouse because she was in the hospital, trying to get her paperwork straight to, and again, they were documented as far as they were here working legally, but they wound up deporting the sister and the both sisters, right? She asked if she could take her 3-year-old child with her. And they said, no, he's a U.S. citizen. He needs to stay here in Pensacola with someone. So she wound up leaving that child with her sister's partner, that she had children by as well. They deport them to Mexico. They're from Honduras, right? They deport them to Mexico, kept all their paperwork, kept their passport, kept everything that they had, right? So they had to make their way to Honduras. By the time she made her way to Honduras and made arrangements to get her child sent to her, that man had killed that 3-year-old child.
Oh my gosh.
So,
jeez.
So when you see those stories, and you actually being at that funeral, I was like, I just, every lawmaker needs to have to go through something just to see the effects of the policies that we're making and how that affects a family, right? How that affects, people. So they allowed her to come back from Honduras to attend her child's funeral. And then she had to fly out the next day to go back to Honduras or whatever. But and they live streamed the funeral so the aunt could see the funeral. But it was so devastating to hear that, to see that. About 3 weeks after that, or a month after that, gentleman was taking his 5-year-old child to the babysitter or child care. before he went to work. And I think he was a painter too, I believe. Now that you mentioned painting, but he was on his way to work. Well, I stopped him, picked him up, left the 5-year-old child in the car alone, waiting on someone to pick the child up. And they went out of sight. So as soon as someone showed up to pick the 5-year-old up, they showed back up. It was like they were using that 5-year-old as bait to see who came to pick him up.
Yeah.
Fortunately, they sent 2 U.S. citizens. They were of Hispanic descent, but they were U.S. citizens to pick the 5-year-old up. So they got the child. But those type of things happen all the time, right?
Yep.
They are detaining and deporting citizens as well, though. There's documented cases of that.
Yeah, absolutely. So we need reform. We need people in place who understand the effects that our policies have on people, on families, on communities. We've had migrant community here, and I heard someone who's from here. I'm not originally from here, but they were saying there have been migrant communities in Baldwin County since there was a Baldwin County, right? There have been people working in the fields. There have been people, just coming in, seasonal workers or whatever, ever since this county was established, right? So
backbone of the economy.
We're all immigrants, man. This is America.
Yeah.
Yeah. And now
it's always immigrants.
Yeah. Now building projects are delayed.
Right.
People's farms are going under because they have no one to even get the crops up or anything, right?
Yep.
But these are the same people, many of the same people that voted for this current administration, right? So we need to do better.
Yeah. I mean, honestly, the immigrant community is a massive part of our infrastructure.
It's literally every generation has another wave of immigrants who does all the labor that the rest of us don't want.
And I would even say
it's how America functions.
Many of them come to this country, and I know this now. This is a New Jersey example. My niece, who I'm a legal guardian for, she's a adult, lives in an adult group home, disabled. The caretakers that take care of her, right? These women are amazing. They are angels. They often come to the United States to find a new life, and they come from other countries and they do that work because nobody else wants to do it because it is hard. And now they're afraid to come here, or they're being deported. And so now we're losing, and I know that that's not just an anomaly in New Jersey. This is an everywhere problem, right?
Yes, it's all over.
We're losing painters, we're losing farm workers, and it's not like
good luck getting your house.
There's not like there's a bunch of American citizens trying to steal these people's jobs, because they're not. I mean,
they're coming here to do those jobs because the jobs are available because no one here wants to do them.
So it's just kind of.
Do you want to do roofing in Arizona in the summertime?
Yeah, it's crazy.
No, you don't. But immigrants will because it gives them an opportunity.
Yeah, right.
Yes.
They're super. Dude, it's amazing. It'll be 110 degrees out, and I'll drive by a house, and these guys are on the roof scraping tile off the roof.
Hardest workers.
And I'm like, I don't know how they're not dying. I would die if I did that. I feel like literally drop dead and fall off the roof.
Hardest working people, right? They're committed, they're motivated, and then we just turn our backs on them. It's just it's
and
a
the
shame.
real thing is, even beyond the atrocity of what we're doing to these people right now, the future of this. It's not just that we're losing them now. How do we convince them later if we actually do get rid of the fascists in charge and go back to the way we're supposed to operate in this country? How many decades is it going to be before we convince them that it's safe to come back in any number?
Yeah.
This is not just now. This is 20, 30, 50 years this is going to affect us for.
It's not going to be easy at all. And the same with our allies, right? They gave us a pass on the first time we elected Trump, but then we turned around and did it again. It'll be 20 years before they trust us, right?
Yeah.
I mean, not just the people that voted for him, but the fact that the people that didn't vote for him allowed it to happen, right? So it'll be 20 years before our allies in other parts of the world will really trust us again as a country.
They're already talking about building a new NATO basically for Europe. To cut us out of it.
Yeah.
Ukraine's saying, hey, let's make a new NATO without the U.S.
Right.
Yeah.
Because Ukraine's the best at war now. They know how this works. Nobody else really knows how war works except Ukraine because they just redefined it.
Yeah.
And like trade partners, nobody wants to trade with us anymore. Nobody wants to be militarily aligned with us anymore. Like we have Israel is the only country that wants to trade with us anymore, and they're the biggest bad guy on the map right now.
A lot of downstream effects from all of this.
Like
a lot.
So, and when if and when I'm going to say when, hopefully very soon, we start taking the fascists back out of power in this country and start being a democracy again.
And we get people like Clyde Jones.
And we get people like Clyde Jones in Washington, D.C.
Right.
But I mean, even if we do turn around and start electing the best people who actually want to do the job right, what can you do to get these other countries to trust us again? What can you do to get these immigrants to trust us again to the point that anyone wants to have anything to do with us?
Oh, again, it's going to take years, right? Yeah, it's going to take years. We need to start in November, though. We have to start by electing the right people in November.
That's right.
To even get started, right? But it's going to be years down the road before these people will ever begin to trust us again, our allies. And you talk about, taking it back to healthcare. You talk about the Haitian people. A lot of Haitian women have been in elder care their whole time they've been here, right? Working in facilities all over the country, taking care of our elderly citizens, right? And then all of a sudden, we were removing the protections away from them and sending them back to a country that we deemed wasn't safe to send people to, right? But we're going to send them and Syrians back to the countries that we said weren't safe to send anybody back to.
It makes no sense.
It
makes no sense. Well, we've covered some healthcare stuff here, but we've gone a little away from that too, which is fine. These are important topics.
My head hurts.
But with the last couple minutes that we have left, Clyde, I just want to give you just an opportunity to share your message, talk about what's important to you, and just remind people why they need to cast a vote for you in the midterms.
Absolutely. So thank you very much. Thank you all for having me again.
Yeah.
Again, Congressional District 1 here in Alabama, we need change. We need change. We need healthcare. I'm all about healthcare for all, doing what we can do to have that affordability, right? Affordability. We need to have solutions when it comes in. And there are so many things that we can do, but we have to be able to get in office to be able to do those things. The state of Alabama and many other states in the South have redrawn lines to try to cut, disenfranchise many black voters, and to disenfranchise or to remove black and Democratic representation from the. So we have an opportunity here in LA is what I call it. So if I say LA, I don't mean Los Angeles. I mean Lower Alabama.
Gotcha.
Here in LA, right? We have an opportunity to change and to shock the world, right? So as far as how you all can help whoever your listeners are, ClydeForCongress.com. You can go to my website. You can see more details about my platform. You can donate. You can volunteer. You don't necessarily have to live in LA to volunteer. You can make calls wherever you are. You can do, certain things that you can do from anywhere in the country. But one of the things that we definitely need to happen is people to turn out and vote, right? We have 3.8 million registered voters in the state of Alabama. And on May 19th, our primary, only 800,000 people voted out of 3.8 million people. 800,000 people voted.
Crazy to me.
On the runoff, on June 16th, 400,000 people voted. So 10% of the registered population voted in the June runoff. We need to get people to the polls. We're always registering people, but we have 3.8 million people registered. We need to get those people that are registered to the polls. We need to get them energized. People are so apathetic about voting, right? They feel like their vote doesn't count. If your vote didn't count, they wouldn't work so hard to try to suppress your vote, right? They wouldn't do the redrawing of the line. They wouldn't do all these things that they do. Alabama is only one of 3 states that doesn't have early voting, right? There's only 3 states left in the country that doesn't have early voting. The only time you can vote is election day in Alabama, unless
Seriously?
unless you have a legitimate reason to vote absentee, which you have to do in person at the courthouse in that county. You have to vote on election day. Again, we're one of only 3 states left in the country that you actually have to vote. And if you don't think that's part of voter suppression, you better think again, right?
Wow.
That is part of voter suppression, right?
So even to vote absentee, you have to do it in person?
Right.
So like people from Alabama who are in the military and are deployed.
You have to mail in your legitimate excuse too, right? I think you can. There's a certain date you can mail it in, but then after that date, you have to do it absentee in person.
Yeah, it's still not easy though. Yeah,
and it's not easy.
That's basically keeping anyone who's in the military who's from Alabama from voting.
Well, you can right? Again, you can mail in if you're in the military, but they're not making it easy for them, right?
But that's the thing. Like if you're deployed, you don't have time to deal with that.
Yeah.
Like it's not like you just got to fill out your ballot and send it in. It's like you got to jump through hoops. You don't have time to jump through hoops when you're on deployment.
Yeah. There are several things you have to fill out, and then fill out.
Alabama needs to change that. Hey, could you do that?
And this whole
I hope to be at the federal level, but in November we also have a lot of. This is the first year in many years that we have a Democratic candidate in every statewide race in Alabama, right? This is the first year in many years we have a Democratic candidate in every congressional district, right? So if people get out and vote, we can make a massive change in the state of Alabama.
We need to get everybody to vote.
Get people out to vote. Yeah.
Wow. Okay.
Coconino County in our primaries that we just had a few weeks ago, I think it was like 28% turnout.
Oh, okay.
Which is,
and it's still better.
The sad thing is, for a primary, that's a lot.
Yeah,
it's barely over a quarter of the populace voting, and people are like, "Oh, that's pretty good turnout." I'm like, "That's disgustingly low."
Right.
It is
everything,
and it's
considering everything that's going on.
Yeah,
and a lot of the races had multiple people from both parties because the parties are both bifurcating now. You have your Democratic Socialist and your Democrat Centrist, and you have your Republicans and your MAGA Republicans. Yeah. And everybody's like, the parties are primarying themselves.
Right.
And so few people went out to vote for the candidate that they want to actually represent their party in the election. That how is that possibly even democratic? Like, it's not democratic unless people vote.
Yeah.
Right.
It's only a democracy if people vote.
Yeah, right. It's that apathy you were talking about, Clyde. I think it's
like when Obama won and we got like 60% of people voting, and people are like, "Oh my God, it's such a huge turnout." I'm like, it's only 60%, man. Like, that's barely over half.
It was only 60%, but look how much higher that is than we've seen since then, though, right? So
sure.
We have to get back to at least that, right? We have to
get back to
at least that. Yeah.
Yeah. The question is, how do we do that?
I honestly think we should do like Australia and make it that election day is a holiday. No one works.
Yes.
Everyone votes, and if you don't vote, you get fined.
That's actually
you have to let and make everyone vote. Like, it's so the other side of how we do it in this country. It's the complete opposite of what no more suppressing the vote. You have to make people vote and make it so that they can. Like, you have to make it so that everyone is voting.
At the very least, they're in Alabama. We need to get you guys some early voting going on there.
Mail-in ballots, man. Arizona, a lot of our secondary elections, like just the state and local
are mail-in
elections. It's literally
mail-in only.
There is no in-person voting. You have to mail it in.
Yep.
That's all they mail you. They mail you a ballot. You fill it out and you mail it back.
Yep.
That's how voting should work in my mind, everywhere, all the time. Like, we probably would get 80% of people voting if they just got it in the mail and filled it out and sent it back.
Yeah,
absolutely. Well, hopefully we have a good turnout next week. Again, I'm not on the ballot next week because I don't have a primary opponent, but I have 3 Republicans that are vying to run against me.
There you go.
Okay.
So
we'll see. November.
Yeah. So we'll see.
I have a question on that end. I hear it a lot. I know I don't know if it's because I listen to liberal news online all the time, but they're talking about how the MAGA candidates are winning all the Republican primaries, and that the Democrats are actually happy about that because they feel like those guys are way less electable.
Do you have that opinion as well?
Are you in that? Are you hoping like the rightest of the crazy right guys wins that primary to run against you?
I hope so. The guy who all his pictures have he and Trump together. I hope he wins. So, perfect. And he actually held the seat. He actually held this seat in Trump's first term, and then he lost in the Republican primary later.
Okay.
But I'm really
I agree. I think that's hugely putting things back in the Democrats' favor. Is the Republicans are running people who just aren't going to get elected, like they're unelectable candidates in so many cases.
Well, good for us Democrats then.
Yeah, I think that's the thing that's going to save us, honestly, because if they were running some candidates that the Republicans would actually vote for, we might still be in some trouble.
But we also have some really great Democratic candidates running. I think it's maybe the most diverse, progressive, unique, really, truly like human, right? Like they represent the best of us.
There's a lot of them actually worth getting excited about, right?
Like now, you.
Yeah.
There you go.
I appreciate that. I appreciate that. And it is an exciting time. Again, we have so many great Democratic candidates here in the state of Alabama. So we're all excited about what can happen. And
awesome.
We're looking forward to November. So
we're rooting for you from Arizona. We will make sure to put all of the links to your website and all that kind of stuff, your social media, in the show notes. Any good resources we can. So in the meantime, keep keeping on, keep up the good fight. Wishing you the best of luck in the rest of the lead up here.
Let's turn the South blue, man.
Yeah, let's do it. Vote for Clyde.
Right. Absolutely. Thank you all so much.
Clyde for Congress. Woohoo.
And I look forward to coming back and talk to you after I get elected. So
100% would love to have you come back. So
that's what I'm really looking forward to. All these people we're interviewing who are running, once they all win, we're going to bring them back and hold your feet to the fire a little bit. It's like, okay, so now what are you actually going to do about it?
Yeah. Now what? Now what, right?
Those are going to be fun conversations.
Good stuff. Awesome. Well, thank you so much for coming on. This has been such a great conversation. I'm so excited for you, and good luck to you and your team.
Thanks for joining us on the Healthcare Uprising. Make sure to hit those like and subscribe buttons before you go, and take a moment to think of a friend and hit that share button. You can find us on all the major audio platforms, and we've got video on YouTube if you want to watch us in action.
You can also find us on social media on LinkedIn, TikTok, and Instagram. Just search Healthcare Uprising to find us. And if you're a new company with a cool new product, if you're someone innovating alternative methods for the health and wellness space, or if you have a personal healthcare journey you'd like to share with us here at The Uprising, please email us at healthcareuprising@gmail.com. And we'll get back to you about coming on the show. Well, that's all for this dose of Healthcare Uprising. Until the next time, keep looking for the good in the world, because sometimes it's where you least expect it.
We are not doctors and we don't play one on TV. If you need medical advice, consult with your physician or a healthcare professional. This has been a Shut Up production.
Shut up!